Hello, this is Dr. Obazor again, and so I wanted to actually test out a presentation that I made recently about newborn hyperbilirubinemia. And so I'm going to go ahead and click step 1. We have a 6-day-old term infant that's admitted for management of hyperbilirubinemia after a follow-up visit reveals a total serum bilirubin level exceeding 25 milligrams per deciliter. The infant was born at 39 weeks and initially discharged with a bilirubin level of 11.6. Parents report that they may have been using a billy blanket over the weekend, but the bilirubin level has continued to rise. The infant's physical exam shows jaundice extending to the abdomen, and the infant is feeding well with normal voiding and stooling patterns. Laboratory tests reveal a negative COMLEX test and a blood type compatibility with the mother. Which of the following is the most likely underlying cause of the infant's bilirubin? Our first answer is increased enterohepatic circulation of bilirubin. So this could potentially be the answer because bilirubin is absorbed in the intestines and then it goes back to the liver to be processed. And so if you have a severely elevated level like we have with this infant, then yes, this can in fact be the answer. So A could be a choice. B, hemolysis due to RH incompatibility. I don't think this is the case because we see right here that we have a negative COMLEX test, right? Negative COMLEX test right there. And we have the option to actually explain the text or generate a question from the selected text if we want to, but we'll save that for later. And insufficient intake leading to dehydration. There's no where in the vignette that assumes that, so I'm going to go ahead and cross that out. And then D, a genetic disorder affecting bilirubin conjugation. So this would be something like Crigler-Najjar syndrome, where you have a deficiency in UDP glucuronidase transferase, which is an enzyme that helps to conjugate a bilirubin. And so, there's nowhere that points towards this per se. And so I think just based off of process of elimination, A is going to be the most likely answer in this case. So I'm going to go ahead and select A and wait for the answer, and there you go. It's just generated just like that. And so just going over the answer, explanation, the infant's hyperbilirubinemia. So the infant's hyperbilirubinemia is most likely due to increased enterohepatic circulation of the bilirubin. In this case, the infant is experiencing physiologic jaundice, which is common in newborns, especially when there's insufficient feeding, leading to dehydration and decreased bilirubin excretion. The negative COMLEX test indicates that hemolysis is not occurring and that the infant's feeding and stooling patterns suggest that dehydration is not the primary cause. Therefore, the accumulation of unconjugated bilirubin is likely to be the reabsorption of bilirubin from the intestines back to the circulation, exacerbated by insufficient intake. Right. So it's a very clear explanation, going in depth about why the answer choice is right. But let's say I don't know anything about the COMLEX test, and I just want to dig a little bit more into that. So I'm going to go ahead and highlight COMLEX test. I'm going to click Explain Selected Text, and I'm going to go ahead and, oh, there you go. The direct COMLEX test. It kind of goes over the purpose, the procedure, the clinical significance, and it goes over the indirect as well as direct COMLEX test. So that way you're able to differentiate between the two. And if I wanted to, I can actually make further questions. Let's say I see hemolytic disease of the newborn. If I wanted to, I can go ahead and generate a question from the selected text and wait for it. And it's generally pretty quick. And there you go. Another question is just generated instantaneously. So as you can see, BoardMaster can be a very powerful tool that helps you not only study for your slides right here on the side, but it also helps generate questions instantaneously, so that way your learning is active and not passive. If you have any questions or feedback you want to provide us, please do so right here at this link, and we'll see you in the next video. Take care.